there are basically three terminologies that you definitely need to know before going into mandibular movements. All these terminologies have been taken from the Glossary of Prosthodontic Terms, the 9th edition. The first important terminology is the centric relation. The centric relation is a bone-to-bone relationship. So it is a maxillomandibular relationship independent of tooth contact, which means this relationship does not depend on whether the teeth is present or absent. This relationship will still exist. In this relationship, the condyles articulate in the anterior superior position against the posterior slopes of articular eminence. Now this is your articular eminence. Here you have the anterior slope and here you have the posterior slope. This is the condyle of the mandible. Now this condyle is not articulating with the superior-most position of the articular fossa, right? It is going to articulate with the posterior slopes and it is oriented in an antero-superior position. In this position, the mandible is restricted to a purely rotary movement. What does this mean? This means that when the condyle is in the centric relation position and when the mandible has assumed this position, then the mandible can only open and close, which is going to create a purely rotary movement. That is, the condyles are just going to rotate in the joint cavity. They are not going to make any bodily movement away from the joint cavity. From this unstrained physiologic maxillomandibular relationship, the patient can make vertical, lateral, or protrusive movements. This means that this relationship is basically the starting point from which all other mandibular movements are going to happen. And this relationship is an unstrained and physiologic relationship. It is a clinically useful, repeatable reference position. Now, this particular sentence is of very importance to us as clinicians. The reason being, this centric relation, we know it to be an unstrained physiologic relationship. We know that all the mandibular movements are basically going to begin from the centric relation position, right? And this particular position is repeatable, which means we can guide the patient into this relationship. The patient can definitely, this means we can guide the patient into this centric relation position. So the mandible can make movements which are repeatable and reproducible. So any movement that is made by the mandible which is repeatable and reproducible accurately, then we as clinicians can definitely record them using some kind of instrument. And since this relationship seems to be the starting point for other movements, it is important that we definitely record it and transfer it to the articulator. Next, let's move on to centric occlusion. Occlusion basically means the relationship between the upper and the lower teeth, right? Now, centric occlusion is basically the relationship of the upper and lower teeth when the mandible is in a centric relation position. So basically, when the mandible has gone to a centric relation position, whatever relationship that exists between the upper and lower teeth, we call it the centric occlusion. This may or may not coincide with the maximal intercuspal position. What is maximal intercuspal position? Let's see that. The maximal intercuspal position is basically a tooth-to-tooth relationship. We saw that centric relation was a bone-to-bone relationship. So maximal intercuspal position is a tooth-to-tooth relationship that is independent of condylar position, right? So when your teeth are in this position, when the mandible has assumed the maximal intercuspal position, it does not matter whether the condyle is going to be in a centric relation position or not. So what do you mean by this maximal intercuspal position? It is basically the position when we all bite, when we clench the teeth. We will see that the upper and lower teeth are perfectly aligned on top of each other, right? They perfectly fit into each other. So this position is the maximal intercuspal position. This position is the very easy position which we all can come into. And this is referred to as the best fit of the teeth. Now, what is the difference between the centric occlusion position and the maximal intercuspal position? Basically, in centric occlusion, we saw that the mandible is definitely going to be in a centric relation position and whatever the relationship of upper teeth is there in that position is your centric occlusion. Whereas in maximal intercuspal position, whether the mandible is in a centric relation position or not, the teeth are definitely going to fit into each other. It is seen that in most dentate patients, that is patients who have all their teeth, these two positions do not always coincide. That is, the position that is best for the mandible and the condyle and the position that is best for the teeth may not coincide in many patients. There is a slight difference between the two. That is why in centric occlusion you can find that there is a slight gap between the teeth, because this may not be the best fit for the patient. I will be going more into this in the upcoming slides. Now let's look at the factors which are going to influence your mandibular movements. We basically have three important factors: the temporomandibular joint, the muscles of mastication, and dentition.